Wiza Bondele is on the front lines in Bunia, fighting against the fastest growing Ebola outbreak on record. He's among specialized health workers trying to contain the highly infectious Bundibugyo strain. The risks involved in the job are not new to Bondele, but health workers like him say they've gone for months without pay, and going on strike is a risk to gains so far made in the fight against Ebola.
We went on strike because we saw that we were working under dangerous conditions and sacrificing our energy. You find yourself in a situation where patients are vomiting blood and you have to clean it up. We face those kinds of risks. We deserve both our allowance and our salary. When we realized that the authorities were saying nothing about our pay, we decided to go on strike.
Ituri province in eastern DRC is the epicenter of the latest Ebola outbreak. Many health workers there are threatening to down their tools of trade. Rallying at the governor's office, they say the government owes them wages that date back to mid-May.
Without the effort of nurses, doctors, and hygienists, you can't defeat Ebola. We're fighting this without even being acknowledged. We put our lives and those of our families in danger. Because if I'm hit by the epidemic, my wife, my children, and my parents at home would also be infected.
The World Health Organization says it's received less than half of the funds pledged for an effective response to the outbreak. But with resources constrained, Ebola is now active in 5 provinces in the DRC. Nearly 4,000 people have been infected, and more than 1,800 have died. Officials in the DRC are blaming payment delays to logistical challenges. But the UN warns that any disruption to the response on Ebola makes it even more difficult to reach communities and quickly break transmission. Felix, Nyawara, Jazeera.